And we will start with the item 1, supine to side lying onto the intact side. So for the score 1, client will use intact arm to pull body towards intact side. Use intact leg to hook impact leg to pull it over. Okay, that is score 1. For score 2, client will actively move impact leg across body to roll, but leave impact arm behind. That one is score 2. And for score 3, client impact during the movement, the impact arm is lifted across body with another arm. Impact leg move actively and body follow as a block. Yes, that is score 3. For score 4, client will actively move the impact arm across body. The rest of the body move as a block. That one is score 4. For score 5, client will actively move impact arm and leg rolling to the intact side, but client will be having overbalance. Okay, that one is score 5. For score 6, client is able to roll to the intact side in 3 seconds without using of hands. So that one is score 6. For score 1, patient is assisted to the side lying position, which is right now, already placed in side lying position. For score 1, patient can lift their head. Patients can lift her head sideways but can't sit up. Score number 2, patient may be assisted to side lying and assisted to sitting but has head control. For score number 3, patient may be assisted to side lying, such as in the position right now. Assisted to lowering their lower limb to assume sitting positions. For score 4, patient may be assisted to side lying position, such as right now, but able to sit up without any help. Okay, that one is score 4. For score 5, patients able to move from supine to sitting without any help. That's score 5. For score 6, patients able to move from supine to sitting without any help and can sustain. Patients can move within 10 seconds. That one is score 6. For score 1, patient assisted to sitting and need support to remain sitting. For score 2, patient able to sit unsupported for 10 seconds with arm folded, knees and feet together and feet on the floor. For 10 seconds. Okay, that one is score 2. For score 3, patient sit unsupported with weight shifted forward and evenly distributed over both head and leg. Head and spine, thoracic spine is extended. That one, score 3. For score 4, patient sit unsupported with feet together on the floor, hand resting on thighs. Without moving the leg, client turns the head and trunk to look behind, starting from the right and left shoulder. That one, score 4. For score 5, sit unsupported with feet together on the floor without allowing the leg or feet to move. Without holding on the patients must reach forward to touch the floor within 10 cm or 4 inches in front of them. The affected arm may be supported if necessary. Score 6. Sit on stool supported with feet on the floor. Patient will reach sideways without moving the legs or holding on. Return to sitting position. Support the affected arm if needed. For score 1, patient is assisted to standing with any method. For score 2, patient is assisted to standing. The patient weight is unevenly distributed and may use hand for support. For score 3, patient is able to stand up, but patient weight is evenly distributed. Hip and the knees are flexed. No use of hand for support. That one, score 3. The score for 4, patient stand up and able to remain standing for 5 seconds with hips and knees extended and the weight is evenly distributed. That one is score 4. For score 5, patients able to stand up and sit down again. When standing, hips and knee are extended with weight evenly distributed. That one is score 5. For score 6, patient able to stand up and sit down again 3 times in 10 seconds with the hip and knees extended and weight evenly distributed. Throughout this assessment, a supervision from the therapist is required to avoid any fall accidents through assessment during conducting the assessment. For score 1, with assistant, the patient stand on the affected leg with affected weight-bearing hip extended and step forward with the intact leg, such as that one is. For score 2, patients will walk with the assistance of one person, such as for item number 3, patients will walk 10 feet or 3 meters without any assistance but with an assistive device. So client score 3. Score 4. Clients able to walk for 16 feet or 5 meters without any device or assistance in 15 seconds. If client able to do within 15 seconds, client will score 4. If not within the time, client will score 3. For the score of 5, client will walk 33 feet or 10 meters without any assistance or a device. Client is able to pick up a small object from the floor with either hand and walk back in 25 seconds, such as for the score of 6, clients able to walk up and down for 4 steps without or with a device, but without holding the rail of the stairs for 3 times in a row in 35 seconds, such as therapists will place affected arm in 90-degree shoulder flexions and hold elbow in extensions, hands towards ceilings. The patients will protract the affected shoulder actively. Therapists will place the affected arm in 19-degree shoulder flexions, and the patients must maintain the position for 2 seconds with some external rotation and with elbow at least 20 degrees or full extension. Shoulder flexions and bring hand to the forehead. Extend the arm again. Flexion and extensions of the elbow. Patients may assist with the supinations of the forearm. Patients must hold the affected arm in position for 2 seconds with some shoulder external rotations and forearm supinations. No excessive shoulder elevations or pronation is allowed. In sitting positions, patient will lift affected arm to 19-degree forward flexions, hold it there for 10 seconds, and then lower it with some shoulder external rotations and forearm supinations. No pronations. Hold it for 10 seconds. Score 6. In standing position, have patient's affected arm abducted to 19 degree with palm flat against the wall. Patients must maintain the arm positions while turning body towards the wall. On the table, and then therapist place cylindrical object in patient's palm. Client is asked to lift the object off from the table by extending the wrist. Do not allow any elbow flexions. You just this one, not this one elbow do not flex. Just the spherical object to your right hand. I will place for score for hand movement score 2. I will place this object inside your palm and then I want you to grip it. Lift up your hand without flexing your elbow or do any pronations. Okay, good. Okay, good. For the score of 3, in a sitting position, client place elbow into sides. You can place your elbow into sides both. And then pronation and do pronation and supinations. Your elbow must be unsupported. And then, yeah, you just do just turn your hand like this, both hands at the same time. Okay, can you do a bit? Or in sitting position, place a 5-inch ball on the table so patient have to reach forward with the arm extended to reach it. Have the patient reach forward with shoulder protected, elbow extended and wrist in neutral or extended. Pick up the ball with both hands and put it back in the same spot. For score 5, continue in sitting positions. Have the patient pick up a polystyrene cup with their affected hand and put it on the table on the other side of their body without any alteration to the cup. So client able to score 5. For 40 times in 10 seconds. Each finger name in turn tap with the thumb, starting with the index fingers. Do not allow the thumb to slide from fingers to another and go backward. Must start with the index finger and needs to complete in 10 seconds. For score number 1, client is asked to pick up the top of a pen and put it down again. So I want you to reach forward. You just put your hand both on the table. Okay, just relax. Okay, I want your right hand to reach forward for the pen top. Reach, okay, and then place it near to you. Okay, good. Pick up one jelly bean with their affected hand and place the jelly beans in the cup on the intact side. Client may demonstrate. It is recommended to use teacup. Draw horizontal lines from this one for 10 lines, at least 10 lines we can do. I will time you in 20 seconds. So your time starts now. For score of 4, client hold a pen and then I want you to make rapid consecutive dots on the sheets of paper. You must do at least 2 dots per 5 seconds. So you just do the dots and then when the time is up, I will ask you to stop. Okay, your time starts now. Stop. Have the patient take a dessert spoon of liquid to their mouth and their affected hand without lowering the head toward the spoon or spilling any liquid. 3, for the score of 6, have the patients in sitting position, such as our model right now. Have the patient hold a calm and calm the back of their head with the affected arm in abduction and external rotations and forearm in supinations. You can ask the client to comb their hair as usual.